Endocarditis. Introduction. Endocarditis is an infection and inflammation of the inner lining of the heart, endocardium, primarily affecting the heart valves. It is usually caused by bacteria, fungi, or other microorganisms that enter the bloodstream and attach to damaged areas of the heart. If left untreated, endocarditis can lead to severe complications like heart failure, valve destruction, and systemic embolism. Early diagnosis and prompt treatment are crucial to prevent life-threatening outcomes. Definition. World Health Organization, WHO. Endocarditis is an inflammatory condition of the endocardium, often due to infection by bacteria, fungi, or other microorganisms, affecting the heart valves and inner chambers. American Heart Association, AHA. Endocarditis is an infection of the inner lining of the heart chambers and valves, usually caused by bacteria entering the bloodstream. Risk factors. Prosthetic heart valves. Congenital heart defects. History of previous endocarditis. Rheumatic heart disease. Intravenous, 4, drug use. Indwelling medical devices, example central venous catheters, pacemakers. Poor dental hygiene or recent dental procedures. Immunocompromised state, example HIV, chemotherapy. Etiology. Bacterial infections. The most common cause of endocarditis is bacterial infection. Streptococcus viridans is frequently associated with subacute endocarditis, especially following dental procedures or due to poor oral hygiene. Staphylococcus aureus is a leading cause of acute endocarditis, often seen in intravenous, 4, drug users and patients with medical devices like catheters. It is known for causing aggressive valve destruction. Enterococcus species, typically originating from the gastrointestinal or genitourinary tract, are common in older adults and those with underlying infections. Fungal infections, though rare, fungal infections like Candida and Aspergillus can cause severe forms of endocarditis. These are more likely in immunocompromised individuals, patients receiving long-term intravenous therapy, or those with prosthetic heart valves. Fungal endocarditis requires aggressive antifungal medications and sometimes surgical treatment. Other microorganisms, Hasek group. The Hasek group includes Haemophilus, Aggregatibacter, Cardiobacterium, Eichnelia, and Kingella, which are gram-negative bacteria normally present in the oral cavity. They can cause slow-growing subacute endocarditis and may require prolonged antibiotic therapy for successful treatment. Classification. 1. Based on cause. Infective endocarditis, i.e. due to bacterial or fungal infection. Non-infective endocarditis, marantic sterile vegetations, often associated with malignancies or autoimmune diseases. 2. Based on course. Acute endocarditis, rapid onset, often caused by virulent organisms, example S. aureus, severe symptoms. Subacute endocarditis, slow progression, often caused by less virulent organisms, example Streptococcus viridans. 3. Based on affected valves. Native valve endocarditis, NVE, occurs on natural heart valves. Prosthetic valve endocarditis, PVE, occurs on artificial heart valves. Pathophysiology. Entry of pathogen into bloodstream. Down arrow. Adherence to damaged endocardium or valves. Down arrow. Formation of vegetations, platelets, fibrin, microorganisms. Down arrow. Valvular damage and embolic events. Down arrow. Impaired cardiac function and systemic manifestations. Clinical manifestations. Fever, chills, night sweats. Fatigue, weakness. New or changing heart murmur. Petechiae, small red spots on skin. Osler's nodes, painful nodules on fingers/toes. Janeway lesions, painless red spots on palms/soles. Splinter hemorrhages, streaks under nails. Roth spots, retinal hemorrhages with pale center. Shortness of breath, if heart failure develops. Weight loss. Diagnostic evaluation. Medical history and physical examination. A thorough medical history and physical examination are essential to assess for potential risk factors such as previous heart valve disease, recent dental procedures, for drug use, or prosthetic valves. The examination focuses on detecting heart murmurs, which may suggest valve involvement, and identifying signs of embolism like petechiae, Janeway lesions, or Osler's nodes. Blood cultures. Blood cultures are critical for identifying the causative organism. Typically, at least 3 sets of blood cultures are taken from different venipuncture sites before starting antibiotics to ensure accurate detection. These cultures help guide targeted antimicrobial therapy. Echocardiography, transthoracic/transesophageal echocardiography, either transthoracic, TTE, or transesophageal, T, is performed to visualize vegetations on the heart valves, detect abscess formation, and assess the function of cardiac valves. T is more sensitive and often preferred for better visualization, especially in prosthetic valve endocarditis. Electrocardiogram, ECG. An ECG is used to detect any conduction abnormalities that may arise if the infection spreads to the cardiac conduction system. Findings such as heart block or arrhythmias may indicate paravalvular abscesses and require immediate attention. Chest X-ray. A chest X-ray helps identify secondary complications such as cardiomegaly, enlarged heart, or signs of congestive heart failure like pulmonary edema. It provides a general overview of the heart and lung condition. Complete blood count, CBC. CBC is typically performed to assess for leukocytosis, which indicates infection, and anemia, which is commonly seen in subacute bacterial endocarditis. These blood parameters help support the diagnosis and monitor disease progression. C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. Both CRP and ESR are nonspecific markers of inflammation that are usually elevated in endocarditis. These tests help in assessing the inflammatory response and monitoring the effectiveness of treatment over time. Urinalysis. Urinalysis may reveal microscopic hematuria, which can occur due to embolic phenomena affecting the kidneys. This test helps identify systemic involvement and possible complications arising from endocarditis. Cardiac MRI/CT scan. Cardiac MRI or CT scans are advanced imaging tools used in complicated cases to get detailed views of the heart structure, detect abscesses, and evaluate paravalvular extension of infection when echocardiography is inconclusive. Medical management. Antibiotic therapy, based on culture sensitivity. Penicillin, ampicillin, ceftriaxone, for streptococcal infections. Vancomycin, daptomycin, for MRSA or resistant infections. Gentamicin, for synergy in enterococcal infections. Antifungal agents, example amphotericin B, in fungal endocarditis. Duration. Usually 4 to 6 weeks of 4 antibiotics. Symptomatic treatment. Antipyretics for fever. Diuretics for heart failure symptoms if present. Surgical management. Valve repair or replacement, if severe valve damage or persistent infection. Abscess drainage. Removal of infected prosthetic material. Rehabilitation and supportive care. Physical therapy, enhance functional status post-treatment. Nutritional support, adequate protein and calories for healing. Psychological support, coping strategies for chronic illness. Patient education. Importance of completing antibiotic course. Recognizing early signs of infection. Maintaining good oral hygiene. Prophylactic antibiotics before dental/surgical procedures in high-risk individuals. Nursing management. 1. Decreased cardiac output related to valvular damage and infection of heart lining. Interventions. Monitor vital signs, including heart rate, blood pressure, and oxygen saturation. Assess for signs of heart failure, example dyspnea, edema, fatigue, crackles in lungs. Monitor heart sounds for new or changing murmurs. Administer prescribed medications, example antibiotics, diuretics, to control infection and manage fluid overload. Monitor intake and output and daily weight to assess fluid balance. Encourage rest and limit physical activity to reduce cardiac workload. 2. Risk for ineffective tissue perfusion related to embolization of infected vegetations. Interventions. Assess neurological status regularly, example level of consciousness, limb strength, to detect signs of stroke. Monitor skin for signs of emboli, example petechiae, splinter hemorrhages. Monitor for signs of organ dysfunction, example renal function, abdominal pain. Maintain bed rest as advised to prevent embolization. Educate the patient about the importance of reporting sudden changes, example vision changes, weakness, chest pain. 3. Activity intolerance related to fatigue and systemic infection. Interventions. Assess tolerance to activity and monitor for signs of fatigue. Plan care with adequate rest periods between activities. Encourage gradual increase in activity as tolerated. Teach energy conservation techniques to manage fatigue. Provide assistance with daily activities as needed. 4. Acute pain related to inflammatory process in cardiac tissues. Interventions. Assess pain level, location, and characteristics regularly. Administer prescribed analgesics to relieve pain. Provide a calm and quiet environment to reduce stress and pain. Teach relaxation techniques such as deep breathing to manage discomfort. Monitor for worsening pain, which may indicate complications, example worsening infection, embolization. 5. Knowledge deficit related to lack of information about disease process and treatment. Interventions. Educate the patient about the cause and treatment of endocarditis. Explain the importance of completing the full course of antibiotics. Teach the signs and symptoms of complications, example heart failure, embolism, to report immediately. Instruct on preventive measures, such as maintaining good oral hygiene and prophylactic antibiotics before procedures if recommended. Encourage follow-up appointments for ongoing monitoring. Prevention. Prophylactic antibiotics before dental or invasive procedures in high-risk individuals. Good oral hygiene and regular dental care. Avoid for drug use. Sterile techniques for invasive devices, example catheters. Management of predisposing heart conditions. Complications. Heart failure due to valvular damage. Embolic events, stroke, pulmonary embolism. Valve perforation or rupture. Abscess formation. Arrhythmias. Glomerulonephritis, immune complex deposition in kidneys. Sepsis and multi-organ failure. Conclusion. Endocarditis is a serious and potentially life-threatening condition that requires prompt diagnosis and aggressive treatment. Early antibiotic therapy, surgical intervention when needed, and preventive strategies are crucial for favorable outcomes. Nurses play a vital role in monitoring, medication administration, education, and supportive care to improve patient recovery and prevent complications.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.